Coming up this week on Talk with Audrey, Dr. Klane White, Rose Brown Endowed Chair of Pediatric Orthopedics at the Children's Hospital in Colorado, joins me with the latest medical advancements to offer some hope to parents and families of children diagnosed with achondroplasia. Michelle Reisdorf is District President and a workplace trends expert with talent solutions firm Robert Half. She has key information that job seekers need to know about the job market and some tips for applying to your next position. It's all coming up this week on Talk with Audrey. Insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back.
It's difficult to find a person in America right now whose life has not been impacted by the opioid epidemic. In fact, a recent report found that enough opioids were prescribed in 2016 for every man, woman, and child in the nation to have 36 pills each.
Addiction is taking a toll on millions of lives across America, but together we can reduce the devastation and work to end addiction. And it all starts with prevention. Now more than ever, it is important that we educate and empower patients to talk to their doctors about their post-surgical pain management options. If we could reduce the number of opioids prescribed after surgery by just 10%, it would mean almost 332 million fewer leftover pills available each year for potential diversion and misuse.
These prescription painkillers are not our only option for treating pain, especially after surgery. To learn more, visit planagainstpain.com.
You're watching Talk with Audrey. Welcome back. Achondroplasia is a genetic condition that affects bone growth, and it's the most common form of dwarfism, which impacts nearly 50,000 Americans. And while it's often associated only with short stature, people with achondroplasia can face health complications on top of the emotional toll of social stigmas and biases. Joining me with the latest medical advancements to offer some hope to parents and families navigating the diagnosis, Dr. Klane White, Rose Brown Endowed Chair of Pediatric Orthopedics at the Children's Hospital in Colorado. Welcome.
Well, thank you for having me.
My pleasure. So tell us more about achondroplasia and how it might impact a person's life beyond just height limitations.
Well, you've already done a really nice job of summarizing achondroplasia. So what you didn't say is that, this really results from a change in one of our genes that mediates growth. So this is a genetically mediated condition that results in about an average height of 4 feet 4 inches in males and 4 feet 1 inch in females. And so while most people with achondroplasia live very happy and productive lives, for many tasks, they rely on adaptive equipment and activities such as driving, shopping, and other forms of self-care.
And when someone is born with achondroplasia, what are the treatment options that are available?
Yeah, so families come to us often with infants who have been diagnosed at birth. First of all, it's really important that they establish care with an experienced healthcare team. A lot of what we do for achondroplasia is screening and observation for potential complications at a young age. So many infants with achondroplasia will need an MRI and a sleep study within the first 4 to 6 months of life. And then they might need surgical treatments for those conditions. There are some newer treatments on the horizon and there's one that's actually approved by the FDA that can help with growth. At this point, it's unclear how much that will help some of these surgical conditions very young in life, but in the long term can certainly accelerate growth for the individuals as they become adults.
And how long does the treatment actually take before patients might see results? And is it something that's guaranteed to work?
Yeah, that's a really important question. So it's not an overnight, the medication that's available, that's approved, is not an overnight fix. It's a medication that needs to be taken daily and results in progressive improvement or growth velocity increase. And so if you look at someone who's on a growth treatment versus one who is not, the expected average increase in growth is about 1.5 centimeters or 0.6 of an inch. So the way I explain it to families is that over 10 years of treatment, they will increase their growth by about 6 inches. So that's kind of where the treatment goes. And so it takes about 10, they start when they can start any time while they're still growing, but they would stop treatment once they were finished growing.
I see. And you mentioned, doctor, that there are some other health complications like sleep disordered breathing and chronic pain and dental issues. How and why do people with achondroplasia develop those issues, and how do they come into play?
Well, so again, typically most people with achondroplasia are quite healthy and live active and healthy lives, but there are certainly some unique considerations for those people who have achondroplasia. I've already mentioned as infants, they can develop life-threatening spinal cord compression, and this results in an increased rate of sudden infant death syndrome. It's been estimated to be as high as 7% in babies with achondroplasia, which is, of course, is way higher than the average population. They can have obstructive sleep apnea. So because of a little excess tissue in their back of their throat, they are unable to breathe adequately when they sleep at night. And so these will need to be treated surgically. As young children, they have a higher incidence of ear infections, and again, this problem with breathing. And then as they grow even older, then the most typical problem, or I should say the consequential problem, is that they develop a narrowing of their spinal canal, which can compress nerves, which often requires surgery as young adults or even older adults, can lead to long-term weakness and disability if not treated.
And what if any of the issues that you mentioned are left untreated? What's the prognosis?
Well, certainly nerve compression injuries, if left untreated, again, lead to weakness and can result in loss of bowel and bladder control, inability to walk. I will say that individuals with achondroplasia do seem to have a higher rate of low back pain, and that in its own right can also cause some disability. The treatments for the back pain are not as reliable as our ability to treat nerve compression injuries. So that's why we do encourage patients with achondroplasia to get regular healthcare checkups with providers who know what they're looking for.
Doctor, what should parents consider if they're caring for a child diagnosed with achondroplasia?
Well, first of all, I want to reiterate that it's important to reassure families that a child will grow up and be a happy and active child. They might not be as tall as their peers, but it doesn't seem to slow them down. They should, however, again, be seen regularly by an experienced healthcare team to ensure that potential is maximized.
Dr. White, where can we go for some more information?
Well, there are many resources out there for community and support. First, I would check with your own local healthcare provider. Here at Children's Colorado, we have a robust website of educational materials and a list of other families that are willing to share their experiences. Alternatively, you can visit Little People of America at LP Online or visit risinglove.com, which is a resource provided by BioMarin. But remember, there are many other communities and resources out there that can support all aspects of achondroplasia, and they can be looked up online.
Dr. Klane White has been my guest. We've been talking about achondroplasia. It's the most common form of dwarfism and impacts more than 50,000 Americans. Check out those websites for more information. And of course, be sure to check with your doctor or your healthcare provider. Dr. White, thank you so very, very much for joining me.
Thank you for having me.
I'll be right back after the break.
Atrial fibrillation. It affects your heart, but it can also affect your mind. Why? Because of stroke. The risk of stroke is 5 times higher in those with AFib. By preventing blood clots from forming, AFib patients can lower their risk of stroke. Talk to your doctor. Find out your risk and how to reduce it. Visit myafib.org.
Okay, which one is better? 1 or 2? 1 or 2? 1 or 2? 1, 2. 1, 2. 1, 2. 1. Nearly 1 billion people live with completely avoidable vision loss. Don't be one of them. Get your eyes checked.
Welcome back. According to Robert Half research, the majority of surveyed professionals say that they're happy in their current roles, and only 29% are planning to look for a new job, say within the next 6 months. Joining me with details from their survey and key information that job seekers need to know about the job market and some tips for applying to your next position, Michelle Reisdorf, District President and Workplace Trends Expert with talent solutions firm Robert Half. How you doing, Michelle?
I'm great. Thank you for having me.
So there's lots going on out there. What are some of the trends that are impacting job seekers this year?
Yes. So what we have found is that career satisfaction is at an all-time high. As you mentioned, 81% of workers are happy with their current positions, and less than a third of them are actually looking to find a new job. They are very much all about career progression and transparency in things like salary ranges and job descriptions. And so as an employer, you have to understand that if you have open positions, this is what you're working against and what you need to know to attract talent.
And once employers have attracted that talent, why do people stay?
Well, over the course of the last several years coming out of the pandemic, a lot of people did make job changes, and they were able to find positions that were more competitive in pay, offered more flexibility with hybrid, and offered great cultures. And so, with all of those things matching the things that they are looking for, their career satisfaction is high. And so they really have to think about whether or not to leave the current role. Something's got to be much better for them to take that chance.
And of course, there's this hybrid work options that have also come into play. Has the option to work from home become one of the key factors that's attractive to employees when accepting a position?
It's definitely, yes, I would say flexibility is key, whether it's number of days on site or, starting earlier, starting later. Flexibility is a key factor for candidates when considering a position, and employers need to keep flexibility as an open option, again, if they are looking to retain that talent.
And what are some of the top factors that contribute to workers feeling very satisfied with their current positions?
It's what we call the 3 C's. So competitive pay, culture, and career pathing. And for us, what's most interesting is that career pathing has become the new item that candidates are looking for. They are not just looking for a job or a role. They are looking for an employer that can give them a path for the next 3 to 5 years or even longer. We recently just interviewed and worked with a candidate who was looking for a job. And while she was interviewing for what we thought was the perfect role, it just wasn't clicking. And, she wasn't bought in. And what we found was, after a little bit more research into what was important to her, long-term growth was what she was really looking for. And so we had to tweak her search in order to find her the perfect job.
And likewise, Michelle, employers are looking for that perfect fit. So what's their criteria?
They're looking for candidates that do want to build and grow with the company, candidates that have upskilled, as we mentioned. Technology is ever evolving, so you want someone who is willing to learn and grow with your organization, but also be flexible, right? As much as employees want flexibility, so do employers when working with candidates.
Applying for a job has changed. How has AI impacted, or is it impacting, the job search process?
Well, it's new for both employees and employers to use AI. For companies, it certainly helps them find candidates quicker. And for candidates, it's a tool to use in the job search process. But you have to remember, you still need to customize and tailor that application and resume so that it really fits and presents you as the perfect person for the job.
Michelle, when someone's applying, of course they want to stand out as a potential employee, but how do they do that when the employer is searching using AI to find the perfect candidate?
Right. So it's a couple of things. It goes back to kind of what we refer to as ACT. And so it is really making sure, as I talked about, assessing what it is you want and what you're looking for and conducting that perfect search to begin with. But C, cultivating the skills necessary to land that job, as well as cultivating your contacts There's very much a lot still about who you know as much as what you know. And so making sure that those relationships and contacts uncover those roles for you. And then T, back to what we talked about, tailoring that resume. You don't want to take the same resume and apply to every job. You want to tailor that to each and every job and role that you're applying for so that you do appear as a perfect match and not just one more resume in the mix.
And how long is it typically taking for people to get a job should they decide to look for a new position?
Companies today are much more measured about their process. You may find that you'll go through a couple more interviews than you have in the past. But again, as long as you stay very connected and you set your expectations with the employer on what you're looking for, the timeline with which you're looking for, and you have good follow-up, you can oftentimes find the perfect role within a couple of weeks. But if it does take longer, be comfortable with the process. Understand that employers want to make sure that they are finding the right fit, and you want to present yourself as that option.
All right. What else do we need to know, Michelle?
Well, you can certainly visit our website at roberthalf.com. You'll find that there are all kinds of job search tips available to you that you can use. You could connect with a recruiter. Oftentimes, candidates don't realize that they can reach out to a recruiter direct in their job search process. We oftentimes have roles that we know about that aren't posted, so we may be able to make connections for you that you aren't aware of.
So if you're looking for a job, go to the experts, guys. And if you're applying for a job in this new environment, you can't start that process without knowing what an employer is looking for and how to best present yourself. Michelle Reisdorf, District President and Workplace Trends Expert with talent solutions firm Robert Half, has been my guest. Thanks again for joining me.
Thank you.
It's my pleasure. I'll be right back after the break.
This year has brought on many changes. You took on new projects and learned to do it yourself, like mastering your favorite dish or learning how to change your oil. Turns out it was easier than you thought. Your green thumb may have grown, as did your herbs. Looking back, you mastered many projects, but one thing you may not have tackled is your health, even if you noticed something isn't right. Lung cancer is the leading cause of cancer death in the U.S. When caught early, the 5-year survival rate is almost 60%, but when caught late, it's only 6%. That's why it's important not to ignore common signs of lung cancer, like an unexplained cough or shortness of breath lasting more than 3 weeks. If you're at risk for lung cancer and have these symptoms, don't gloss over it. Do it for yourself and schedule a visit with your doctor today.
You're watching Talk with Audrey. Welcome back. Peripheral Artery Disease, or PAD, is one of the leading causes of amputations and impacts more than 12 million Americans each year. Yet 70% have never heard about the disease and its devastating risk. Did you also know that Black people are 2 times more likely to suffer from PAD and up to 4 times more likely to undergo an amputation compared with whites? Vascular surgeon Dr. Anahita Dua, an interventional cardiologist and Association of Black Cardiologist Society for Cardiovascular Angiography and Interventions, Dr. Foluso Fakorede, joined me to share new survey findings that uncovered a gap in awareness of this deadly disease, the warning signs, and the importance of early screening. Welcome.
Thank you. Thank you for having us.
Appreciate you both for joining me. Let's dive into exactly what peripheral artery disease is and how we can better understand the common risk factors and recognize the symptoms.
PAD is a disease process where there are blockages in the leg such that blood can no longer get all the way down to the toes. It's very similar to having car accidents along a highway, and the cars simply cannot make it all the way down to the end. And the problem is, the more of these blockages that a person may have in their legs, less and less and less blood can make it from the heart down to the foot. And eventually, the actual tissue that makes up the foot and the leg starts to die slowly. And that unfortunately moves up the leg and can lead to amputation. So peripheral just means arms and legs, and artery just means the actual artery. And disease is quite literally that, a disease of the inside lining. Now, there are risk factors, specifically diabetes, high blood pressure, and smoking, that are very intimately linked with having PAD. And the reason is because these three things damage the inside lining of the blood vessel, so that mounds and mounds of calcium start to build up inside the blood vessel and sort of cork it off at different areas. And then blood cannot get where it needs to go. And that, in a nutshell, is what PAD is.
So the signs and the symptoms, I mean, it sounds like this is something that that someone would be able to see if it's progressing.
Well, that's actually something that some patients can see as it's happening, because some of the signs and symptoms of peripheral arterial disease, unfortunately, it's a silent killer. If you have high blood pressure, for instance, 55% of those patients with high blood pressure will have peripheral arterial disease. We know that 80% of those who smoke or use tobacco products will have peripheral arterial disease, and diabetics are 3 to 4 times as high to suffer from peripheral arterial disease. And as Dr. Dua mentioned, it's the buildup of plaque and cholesterol that narrows that artery and leads to poor circulation in the legs to your feet. And once you start experiencing that, some actually lack the sensation to experience that, like diabetics. So they have, neuropathy, or they have that inability to recognize. So that's why it's important for them when they go and see their doctors, and as every diabetic should know in this country, is to take off your socks and have a doctor check your pulse, because that is a sign that, hey, listen, we have trouble upstream. The other thing that you might experience is pain upon walking. When you walk for certain distances and you experience cramping or pain or fatigue where your leg just tires out on you or gives out on you, that can be another sign. Another sign is if you have cool or cold temperatures in your extremities, or you have a non-healing wound or ulcer in your feet, and in spite of all measures, it's just not healing, and you have those risk factors, or you're over the age of 50, and you've had this for a while, you should get a doctor to check your pulse and also check your circulation, and that can easily be done.
Well, so say you're diabetic. Can you give us some questions that people should ask their doctor to start having that conversation?
That's a great question. The first question you should actually ask is, may I take my socks off and can you check my pulse? That's the first question. Do I have PAD? The second question you should ask are any of my signs or symptoms or lack thereof attributed to PAD? Because what I see, especially with diabetic patients, and unfortunately some of them who have experienced family members or witnessed family members who have undergone either toe amputation or limb amputation, is that those questions were not asked as to, one, what are the signs or symptoms of poor circulation? Could this be poor circulation? 3, can you do a comprehensive foot exam on my foot? Can you refer me to someone to do a comprehensive foot exam or to check my pulse if you can't, right? And that's another part of this. We should not normalize just an amputation first strategy being offered to you. You should try and look for upstream preventative strategies or other avenues for you to get treated before an amputation is offered in that setting. And so it's recognizing the signs and the symptoms. If you have a wound that's not healing, an ulcer, has my circulation been checked? Is there a reason that my sugars are off? Are there medicines I should be taking to better control my sugars? Is the wound not healing because my diabetes is not well controlled, which could lead to that non-healing wound and also that's also ultimately leads to an amputation? So there are layers of questions, not only on the patient side, but also on the physician side, because as much as there's a lack of awareness and only 70% to 80% of Americans have never heard of this disease, on the provider side, how many doctors are aggressive in treating those patients upstream as well before an amputation is offered? So those two have to meet in a place where we know that we are empowering that patient, we're being an advocate for them, and they're answering the right questions before it progresses to a debilitating state.
Sounds to me like the bottom line is that if you're diabetic and if you have some of the signs and symptoms that the doctors have mentioned, call your doctor and advocate for yourself. It sounds like amputation doesn't have to be the solution, and you might possibly save your toes or your legs. Thank you both for joining me. Where can we go for more information about peripheral artery disease?
We have a website, www.padpulse.org. Again, that's www.padpulse.org. That is a shared website by all of the organizations that are helping to take care of these patients and has a lot of information that can allow you to get the next step.
And that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.